Happy Thursday. Today I'm so exhausted. I just finished my day. Took a little bit long today. Lots of mental health. COVID-19 is draining. We are all affected. It is quite hard on our emotions. Hi, Kasian. How are you, sis? You know, I just had an experience where I believe it's important for us to talk about this. I'm a parent, and I would like parents to come and listen to this. You know, when as a parent, you are not accepting your child's mental illness, irrespective of the education you get from the healthcare workers, from the psychiatrists, from the psychotherapists, seeing your child, and you impose, I'll put it that way, you impose your beliefs, your culture, or your faith. Don't get me wrong, I'm a believer too, I'm a Christian, but I'm very realistic. I'm a realist in the manner that, in the fact that if a person has, for instance, bipolar or depression, we need to treat it. And it's the same as when you have diabetes or hypertension or pneumonia, you treat it. I cannot, as your physician, send you home and say, go get better, because you're gonna die from pneumonia, all right? If you don't treat your diabetes could get worse, complicate, strokes, heart attacks. There's so many complications. Could go blind. So doctors will treat you, right? So this message is for parents who are consciously choosing to ignore the education we give. Because as far as I know, colleagues, therapists, they would suggest something when your child has a mental illness. They would suggest the medication he or she needs. They would suggest what role these medications, or they would basically educate. Let me rather put it that way. They would educate you. I had an encounter of a young person, 19-year-old, who can make her own decisions, who is struggling with mental illnesses. Not one, not two. So she needs her family support. It doesn't matter, even if she had one mental illness, she needs her family support. This person tells me, my mother believes strongly in the faith that I will be fine. She prays for me, and as such, I cannot be on medication. Guys, stop it. Stop. Mental illness, more especially mood disorder, when you have an episode, when you have, say, bipolar mood disorder, it's when you would have sometimes spells of mania, where you are impulsive, you could buy a lot of things with the money, things that you don't need. You could actually be even hypersexual. This is a reality. When a person is in that mental state and is very ill, they cannot make sane or rational decisions. So if, as a parent, you are placed in this person's life and you intentionally, irrespective of the education you had received in the past about this condition, you take your child off medication, what are you hoping for? What are you hoping to achieve when you are refusing because you have denial that your child is suffering? I was very stern, but of course with tough love, and we all agreed that this person needs to go back to her medication. Yes, the mother could pray for the child, but she needs to go back to her medication. This young lady keeps getting admitted to the hospital, and it becomes a vicious cycle. It becomes a vicious cycle, guys, when your child gets readmitted because you are choosing. You are choosing, and this is an adult. I'm not sure how a mother or a parent gets so involved in the adult child's life that way that she has so much power. And this person, when she's sick, again, she becomes whose responsibility? So please, guys, if your child or your relative, either a spouse or yourself, you are diagnosed with a mental illness, take time to understand it. Take time to appreciate the education you are given, because you are not only helping yourself, but also the level of understanding of the illness itself. Let's normalize mental illnesses, guys, like diabetes. Let's normalize seeking help when we need. Let's stop this religiosity. It is called a religiosity when you are given an option of treating a mental illness like pneumonia, and you are choosing to pray about it. There's nothing wrong with prayer. I'm also a Christian, but if you have pneumonia, am I gonna say, go and pray? You're gonna die from pneumonia. Mental illnesses, if they are not treated, they take away from your life. They reduce your functionality, occupationally, socially, in every way. So when you as a parent blessed to be in your daughter's life or your son's life who is suffering, and you choose to take off your child's medication because you are going to pray for him or her, think again. Please, guys, accept mental illnesses like you would accept diabetes. Let's stop this shaming or being guilty or shameful of these illnesses, because it's delaying people's progress. There are so many people who have mental illnesses. We have doctors who are highly functional. We have nurses. We have teachers who are highly functioning because they are taking their medication. Honestly, I am upset. And also, more than anything, I think it's about time. This COVID-19 is pushing us, actually, to normalize everything about mental illness. Guys, mental illness must be treated like any other. Let's normalize talking about mental illnesses so that our people, our friends, us, we could be free talking to our friends about our mental illnesses. Let's normalize. Why are we normalizing diabetes and high blood pressure? But when you have depression, why do you have to hide when you are taking your Zoloft? Why are we doing that? And also, people that do it, why are you doing that? Do you know that depression, anxiety, PTSD, bipolar mood disorder, all these illnesses, do you know that they don't choose any culture, any race, any socio-economic status? Look at Kanye West. He has all the money in the world, but he has a mental illness. Guys, we need to normalize these illnesses so that we can get the help we need, so that we can also improve people's lives, the quality of life, guys. Because, again, people with mental illnesses, when they are in that phase of illness, it's the very same relatives that don't want to look after him or her. They want to take him to the hospital. Hospitals, yes, they do help, God, but let's stop doing the cycle of doing rehab at the hospitals while we could do these things at home. People with mental illnesses, if they are looked after by their relatives, they accept them, they love them, they support them, the family goes through family therapy to understand the illness, and they make sure that they help them with compliance, they lead normal lives, guys. There's lots of doctors. I know of lots of psychiatrists that have schizophrenia, that go to work every day because, you know what? They have an insight. Their families have insight. They support them because, you know what? They care about their quality of life. When you take away your child's medication or refusing your child to be medicated when he or she needs it, what are you hoping for? Because unfortunately, people who have mental illnesses, when they are ill, they have high risk. I mentioned earlier, some of them, when you have mania, you could be hypersexual. These are high risk behaviors. When I was working in South Africa, I had few of my patients contracting HIV when they were in their mental illness state. They spend a lot of money sometimes. I find it's selfish. It's selfish when a parent is refusing to accept his or her child's diagnosis and decides consciously that I am not going to put my child on this medication. And the sad part is your child runs a risk of having low self-esteem, and this is also high risk of doing other things, substances. This is COVID time, right? Everyone is stressed. Everyone has reached his or her saturation. Children now, I have kids as young as 16 that are struggling with alcoholism, that are struggling with drug abuse. Maybe some of them are struggling with ADHD. The parent is refusing to put that medication, the child on medication. So this is a plea to every parent. If your child or yourself or your spouse or any of your relatives are diagnosed with a mental illness, take time and willingness to learn, understand the mental illness, so that you can be the person who is supportive when your relative cannot make his or her decisions when he or she has an episode. Because if you have no insight by choice, I'm not talking to people who don't know, but if you have no insight by choice because you are choosing to say, I'm going to pray for this, this is the message I'm leaving you with. If you had pneumonia, you come to me and I say to you, go and pray, how would you feel? That's the message for you. How would you feel if I were to tell you, go and pray for your pneumonia? Think about it. When you are refusing medication for your child or your spouse because you are in a position to make decisions for him or her, and you are not making those decisions that would favor him or her, just know that you are stealing from that person. It's a very selfish decision. You are stealing from that person, and you are stealing from his or her progress. You are stealing from the potential that person could be something out there and making something out of himself or herself. Thank you for listening. Thank you so much for watching. Please share this video. Share it to any person who has denial of any mental illness. Let's normalize mental illnesses in our families. Let's normalize mental illnesses and support people as they need support. Because the sad part, when they have that episode, they don't even know what's going on sometimes. And they are expecting, they are hoping, actually, that you could make a better decision for them. Be the good decision maker on their behalf. Thank you so much.